Nonprofit professionals, have you thought about using gift cards? They're especially helpful this time of year. Think holiday gifts for the whole team, year end bonuses, and even direct support to families in need around the holidays. Charity Charge has a free gift card program just for nonprofits with no sign-up fees or ordering minimums. Text or email a digital card for face value, no extra cost, or ship a physical card if you prefer. Let our team support your year-end projects and save money on your gifting. Visit charitycharge.com to learn more and beat the holiday rush. Now, on to the episode. Thanks for tuning in. Hello, everybody, and welcome back to the Charity Charge show, hosted by Charity Charge. This is Grayson Harris, and today we are absolutely pleased to be joined by Renee Yandel. She is the Executive Director of HIV Alliance, and they are doing incredible work for their community. And Renee, I really appreciate you taking some time to join us today.
Yeah, thanks, Grayson. Thanks for having me. So I can start with a little bit about HIV Alliance. So we
Yeah.
are a community-based organization here in Oregon, and we cover 15 counties. And our mission is to provide care to people living with HIV and prevent new infections. But we have always approached that mission in a really holistic manner. So our services cover everything from, really technical nursing and pharmacy care for people who are living with HIV. We have housing services, behavioral health services, peer services. We offer benefits navigation, emergency assistance, lots of different services for people, both for those living with and those at highest risk for HIV.
I really appreciate that kind of broad context. And what I think is so interesting about learning of your organization is how it has really expanded to have that really holistic approach to it.
Mhm.
And in terms of that expansion, too, you have been at the organization for a decent amount of time. I think it's a little over 19 years total.
Yes.
Okay.
Yeah, it's probably over 20 now, but yeah.
Amazing. Can you tell me a little bit about that journey for the HIV Alliance and how you kind of initially got involved?
Yeah, sure. I got involved as I was an intern, and I was in a time in my life trying to get things back on track. This is my early 20s, had a little, side steps there in the early 20s. So I'm trying to get back on track. I'm in a class on human services, and a woman comes to speak about HIV Alliance, and she starts talking about harm reduction, which is this philosophy that's really core to what we do, an often misunderstood philosophy. She starts talking about harm reduction and what that means, meeting people where they're at, acknowledging all the steps in recovery from substance use disorder. And I was really intrigued. It really resonated with me because personally, that's what I felt was missing in terms of my access and my partner's access to treatment. And so I wanted to get involved. So I, followed up with her, and I signed up as a volunteer. And so they put me in the kitchen. At the time, they had a meal program for people living with HIV. And I also interned at Syringe Exchange. And those two things together, really incredible experiences, and just really sort of hooked me for the mission and the values of the agency. Yeah.
That is incredible. I'm
Yeah.
excited to dive more into that whole
Yeah.
story. Love, again, setting the stage. If you could explain a little bit more about what harm reduction is and a
Yeah.
little bit of some of the kind of misconceptions around that as well.
Yeah, absolutely. Well, harm reduction is a philosophy. It's most commonly applied to substance use disorder, but it just recognizes that people who are using drugs, people who have substance use disorder deserve our respect. They are that we should not stigmatize or vilify them,
Yeah.
and that they're dealing with a condition, a medical condition, and that they deserve support and recognition around that. And then it acknowledges every step a person takes along that journey, recognizing that maybe not everyone is ready to fully treat their condition. And it's not as if substance use disorder is the only one like that, right? We all know people who have health conditions, and sometimes they're willing to engage in treatment and sometimes they're not. And that is the same for people with substance use disorder, but that they still can take steps towards being healthier or reducing the harm of their drug use. What it is not, and what is the common misconception of it, is that it is not encouraging drug use. It doesn't say, hey, no problem, use drugs. This is not going to be a problem for you. It definitely recognizes the harm, hence the name harm reduction. So the harm that can be caused by substance use to individuals, to our communities, to families, to children, but it just takes a different approach to it rather than the all or nothing sort of possibly setting people up for maybe not success. They're more acknowledging
Yeah.
the steps that people take.
Understood. I think that it really underscores this holistic approach as well that you have with
Yeah.
the organization in the sense of also meeting people where they're at. Can you tell
Yeah.
me how that kind of philosophy lays the groundwork for the kind of overall mission and these variety of services that y'all provide?
Yeah. I mean, that philosophy of meeting people where they're at and acknowledging their steps and their journey along the path, it is what really hooked me for the HIV
Uh-huh.
Alliance and what I think has been so impactful in the work that we do. We apply this to our supportive housing program where we're working with people living with HIV who are unhoused and have mental health and addiction issues. It is a step-by-step process, really
Mm.
encouraging and empowering them to lead the process because that's what's gonna lead to ultimate success. If we could just sort of decide what people do and do it for them, and then we'd have to be there for the rest of their lives to make sure that that
It's
was
not a
working for them.
sustainable approach.
It's not a sustainable approach, and it's much more sustainable approach for people to feel the power and the impact of their own steps
That
and their own
agency.
success. Yeah, their agency. And that's really what will, carry them for long-term success, carry them into that. Yeah.
Yeah, speaking of long-term success, as y'all have these kind of wider range of different services and support for your community, how in your role are you defining success? Because I'm sure that can come in a lot of different forms, but
Mm,
in terms of staying focused and also
yeah.
saying no to certain,
Yeah.
potential opportunities, how are you
Mhm.
thinking about that?
Yeah. Well, it's a challenge, I'll say, in an organization that covers 15 counties
Man,
and takes a holistic approach to what could be a very narrow mission or a very broad mission.
yeah,
But it's always for me coming back to that mission, always thinking about does this service impact the HIV risk of the individuals that we're serving, or does it impact their access to care and wellness for people living with HIV? So I'm always thinking about that, though there's a lot of things in there. So then within that, you have to kind of get into the nuance of like, what can we do well? What is someone
mm,
else doing well and we don't need to do? Maybe we can advise on, what do we have the resources to do? There's all those other questions
yeah.
in there once you get to that. But my first place is you may want HIV Alliance to do this, but does this really move the needle in terms of preventing infections or helping people live better with HIV?
I really appreciate that context. I'd like to dive in a little bit more on that. So this idea of what services and programs are we, best suited to provide versus maybe
Yeah.
partnering with another organization
Mm-hmm.
within the community or our local
Yeah.
government. How are you making that decision? And do you
Yeah.
have some type of framework that you internally are using on that kind of strategy side?
Yeah, I mean, I think we really lean into our strategic plan there and the objectives and outcomes that we're looking for
Got
in
it.
the strategic plan. So we have four core areas for our strategic plan. So we'll, sort of run it through that framework.
Mhm.
And then it's really a community scan, sort of a community assessment of what's going on out there and listening to our constituents and our clients too, because it may be that there's an organization providing the service, but for some reason, the unique needs of our clients aren't being met in that service, and then you have a choice, and it's always this branching path that you can take two paths. You can just set out on your own and do it yourself then, or you can approach the organization and say, hey, could we provide some consultation? Could we partner with you?
Yeah.
Could we provide some training? And we're generally trying to, partner is our philosophy, and one of our core
Yeah.
values is collaboration. So we're gonna try that part of the path as many times as we can, but also keeping in mind that we don't want to leave our communities without a need met, with a need met
Understood. Yeah.
unmet. Yeah. So yeah.
I appreciate that. And what does partnership look like for this HIV community in Eugene? Is this
y-
a part of the culture of the city? How
Yeah.
are y'all going about these relationships?
Yeah. I do think Oregon has a very collaborative culture. We have a lot of nonprofits here. I think we're known in the US for having just a very high number of
Yeah.
nonprofits. So, collaboration is both, fueled by that and also hindered by that because there can be a lot of competition for scarce
Yeah.
resources.
Yeah.
So that can be a challenge. But you have to remember too, HIV Alliance is 15 counties and the other counties
Mm,
are each unique and different in their own way, have their own landscape of agencies and organizations and government, services. So partnering for us looks very different in each county that we're in.
yeah.
And we are intended to be a community based organization, meaning we meet the needs of the community. And community includes our target populations, but also the other people in the community who
All these counties, pretty
all the
much.
counties. Yeah. Yeah. So partnership looks very different in different places. Some places we directly contract with counties or
Hmm.
cities to provide services. Sometimes we go alongside them. Their nurse is
Yeah.
going to go and provide vaccinations, and we're going to go along and provide syringe exchange. And that's how we partner. So it really is very different in each county, and I think that is it is a unique thing and a strength
Yeah.
of it. It's like our superpower.
I love that, and, this idea of community driving the mission, right? You have these, years of experience at the organization, and with that comes this wealth of experience and knowledge. How do you balance that, that history and that knowledge while also maintaining this, seat at the table for your community in terms of keeping that feedback
Mhm.
there whenever you're in this kind of
Mhm.
executive role?
Well, I mean, I think very carefully, always with humility and an open mind, and bringing in new ideas, keeping new, fresh ideas coming into the agency.
Yep,
That's through recruiting of staff, volunteers, board members, making sure you have board members from throughout your region and from different perspectives,
got
even.
it, especially when you're so
Um,
far-reaching.
yeah, exactly. And staff too, and management, and just making sure that you are listening across the region and you
Mhm.
have engaged. And it's not and I say it like, "Oh, this is how you do it." But no, it's not easy, but and we always have areas to improve,
Yeah,
but, that's kind of, I think, really approaching it with an open mind, and I think it's important in all these places to not assume the best about our community members, our
got it.
clients, but also the county commissioners, the concerned community member that reaches out to you, the public health director, all those people
Kinda
to
view
really
it in as best of a light as possible.
yeah, because we don't always agree. They don't always agree
Mm,
with what we think is best for our clients and the people we serve, or even sometimes the services that we offer. And that's a part
yeah,
of what we do is that sometimes people object to what we do.
understood, and, this year has also just been an overall kind of challenging times for the overall kind of
Mhm.
philanthropic landscape. There's
Mhm.
the federal funding freezes, the government shutdown, SNAP benefits cuts. I know that, especially the food assistance programs that's
Mhm.
adversely affecting your, kind of population, pretty
Yeah.
hard as well.
Mhm.
Can you tell me a little bit more about how y'all are managing that right now and helping still fill that gap that's, increasing
Mhm.
right now in this time?
Yeah. Really looking to creatively use the funds that we have,
Yep,
obviously within what we're allowed to do. And we do have, when you're an entity like HIV Alliance and we have multiple government contracts, there are restrictions on what you
of
can do
course.
as well. But within that, to try to be as flexible and responsive with the funds that we have, and then leaving no stone unturned. We have an incredible grant writer and an incredible team of people
Mhm.
around her that helps her write grants, and really just looking everywhere for those resources, those partnerships. We have here in Eugene, there's a church group, a faith based group that brings us sandwiches every week,
Okay.
and we can give those out to clients. So, really, just looking for all of the partnerships that we may pursue to help meet those needs in the moment for clients, and then being creative and flexible in the ways that we can be.
Got it. In terms of
Yeah.
that creativity and flexibility, you shared that great example with the church. Is there any other partnership or collaboration with the community that stood out to you kind of this past month or so as this big challenge has been kind of unfolding?
Yeah, I mean, I think we have a partnership with Food for Lane County, which is our local food bank. And so we will get resource food from them and give that out to our community. We have a partnership with the local shelter where they give us excess
Yeah.
food that they get donated and excess winter clothing that they get. And we will take that in and then distribute it through our drop in center. Another partnership this month that I've been thinking about, we have a partnership with our local NAACP chapter. We have two community health workers who are in that who are in that office and reach community members who are, coming to NAACP for services. And there again, we leverage the partnership with the food
Yep.
bank. Food comes to the NAACP office. NAACP and our community health workers get it out to people in the community.
That's
And
great.
it's just sort of this beautiful partnership, and there's other organizations there with them too, so other folks can access the services, and they just did a health fair last week for the
Okay.
NAACP. Our community health workers were there, and the community came together. There's multiple organizations that come, they table, they're providing food, they're providing resources. They're having some fun, there was
Mm,
music, there was activities, and that's what you love to see in times like this. Those are the things that will keep us all going and motivated in the right direction, being
100%.
together,
Yeah.
having some fun together, but also helping together.
I love that, and also almost feeling normal too. It's like that sense of
Yeah.
normalcy whenever you have an
Mhm.
event like that. It kind of takes away that stress and the
Mhm.
anxieties that are coming from
Yeah.
the times that we face right now.
Yeah, absolutely. Mhm.
Well, you've
Yeah.
also, recently expanded from what I understand. Can you tell me about
Yeah.
this new center that has recently opened up and kind of
Yeah.
what you're excited about for it and how it's meeting a need within your community?
Yeah. Okay. So one of the communities at highest risk for HIV is the LGBTQ community. So it's
Yeah.
been a long time that we've been involved with the community and had services to
Mhm.
specifically reach that community. So a few years ago, we partnered with another organization called Transponder, and their specific focus is serving trans and gender diverse individuals in our community. We partnered with them and we opened a small shared office, basically, just to
Got it.
test it out and see. There had been a few efforts in the past to have an LGBTQ health or wellness center in the community that had not succeeded. So we didn't want to jump right in. We just sort of dipped our toe. And we started with that and it worked really well. We had a really incredible sort of synergy between the two organizations working
Mhm.
together in that space. We then sought a grant. We got a grant. We found a larger space, which was in
Nice.
actually a local church that was the congregation had left the church, but the church still owned the property.
Got it.
And they extended an offer to us to, hey, bring your model of the LGBTQ health and wellness center
Yeah.
to our space and use our space to try to grow it and fine tune it. And so we did that. And then a donor stepped forward and said, hey, this is working. You're doing a great job here, all of you, the partners. And we brought other partners in at that point. We brought in the local Pride organizing committee,
Mhm.
a group called Queer Eugene who serves LGBTQ youth, and other partners. So we brought these partners together. Things were working well. The donor stepped forward. We purchased a building. We moved in last week.
Wow,
And
that's exciting.
yes, and then we opened up and welcomed some new partners in. We have a new nonprofit called Transition Health, which is also providing gender affirming care to trans and gender diverse individuals. We're going to have our behavioral health there, our clinicians, our HIV testing team. Transponder's going to have their behavioral health counselors there. So it's beautiful. We have a dance group there called AMP. Queer Eugene will be there with the clothing room. We have a food room. So, yeah, we're very excited about it. And yeah, and it's called the Lavender Network, is what we call
Oh,
it.
amazing.
Yeah.
I love that.
Yeah.
That's such a great story. And I think it's amazing whenever that collaboration can also over time organically grow, right? And
Yeah.
it's identifying the need in the community, testing out, hey, is this a small thing we can do to make it better? And then over
Yeah.
time, building on those wins and you get that community buy-in because
Yeah.
it's this organic and kind of authentic way of going about growing. I just absolutely love
Yeah.
that story.
Yeah. Yeah. It's been great. I'm super excited about it. So, yeah.
Nice. Well, outside of this, brand new opening, what does the kind of future look like for the HIV Alliance over these 15 counties as we go towards the
Mm,
end of the year and
mhm.
also into next year?
Yeah. Well, we're getting ready to host our World AIDS Day event. So December
Yep.
1st is World AIDS Day. It's a day we remember people we lost, but
Mm,
also a day we, kind of recommit to the work and honor folks who have been sharing in that work with us. So we have a variety of events happening across the region.
okay.
And so that'll carry us into the end of the year. And then for the second half of our fiscal year and into 2026, we're really looking at the expansion of the Lavender Network, fine tuning that, really
Yep.
helping the community engage in it and hearing what else they need there. Kind of building this communication channel
Yeah.
with the community so that we can adapt and adjust. We're hoping that that space will host lots of events,
Of course. Yeah.
cultural events and enjoyment events, things like that. And so really trying to use the space for that in the next, and see where we can go from there with that space.
That's amazing. And, how can our audience get more involved with the organization and
Yeah.
find more information out?
Yeah. Well, our website is www.hivalliance.org. And that's a great place to go to get information about events, about services, about our region, news about what we do. You can follow us on social media, of course.
Yeah.
And we're always looking for volunteers. As I said, I started as a volunteer here. We really value volunteers, but also donations, in kind gifts. We host a series of holiday events for our clients at the end of the year because many of them don't have family and
Yeah.
don't get to enjoy the holidays like the rest of us do. And so
Mm,
we host big dinners and we give everyone a small gift. And so we're always looking for donations for the holiday dinners. And yeah, those are the best ways, I think. And if you're looking for a job, of course, we have great jobs at HIV Alliance. It's a great place to work. You can
amazing.
find those on the website too. Yeah.
Okay, Renee, thank you so much for
Yeah.
coming on. I really enjoyed our conversation
Yeah.
and diving into the great services that you're providing for your community
Yeah.
across all those counties. Thank you so much.
Yeah. Thanks, Grayson. It was nice to see you.